It's a busy morning at St Vincent's emergency department in Melbourne, and many of the patients are elderly. This man was brought in after blacking out on the street.
Have you had other falls in the past?
Yeah, I had the fall, but I was conscious.
Geriatrician Richard Kane is doing the rounds of the older patients in an effort to avoid unnecessary hospital admissions.
Being in hospital for an older person is a more risky experience than being in their own homes in many ways.
Beverly Minogue's knee gave out last month and she was unable to climb the stairs to her bedroom.
I've got osteoarthritis. It's all worn out. It's bone on bone.
When the 85-year-old went to emergency, she was expecting a lengthy hospital stay. But thanks to a new program which embeds a geriatrician in the emergency department, she went home the next day with daily visits from nurses and specialists instead.
We find that people recover more quickly in their own environment.
I think it's wonderful because, you can stay home. You don't have to be stuck in the hospital and not be able to sleep.
Hospital data shows that more than 100 older patients have been diverted from wards like this one to either home, rehabilitation or aged care over a one-year period. And more than 900 days of in-hospital care have been avoided.
On any given day, 3 or 4 patient beds are available for other patients upstairs that would otherwise have been filled by these patients.
And the data suggests there was no increase in patients who were diverted coming back to hospital. Programs like this are increasing as the number of hospital beds per 1,000 people aged over 65 declines, halving in the last 30 years.
It's really quite a frightening glimpse into the future.
The Peak Doctors Group says any incoming federal government must prioritise a new longer-term funding agreement for hospitals to ensure they can meet these challenges.
We also want to make sure that that funding drives the kind of care that we want and that our elderly Australians need.
Labor has endorsed an increase in federal funding but not yet brokered a new agreement. The coalition says it would negotiate a new agreement as a matter of urgency. Rachel Carbonell, ABC News.